News this morning. We are concerned about your holiday travel, and that's because traveling long distances in the car or on a plane can actually be bad for your health and in some cases deadly. So joining us this morning, board-certified vein and vascular surgeon Dr. Charles Dietzek of the Vein and Vascular Institute. Thank you so much for joining us.
Thank you for having me.
So tell us a little bit about what the potential health risks are.
Well, whenever we're traveling and we're doing that for more than 4 hours, that's considered a long travel period. And that puts us at increased risk for developing a blood clot in our legs. And that blood clot could subsequently break off and travel to the lungs. It's estimated that there's about 900,000 cases of what we call VTE, venous thromboembolism, which is a blood clot in the leg that then travels to the lung. And of that, about 1 in 9 people will actually die. So this is a significant health risk.
Absolutely. So how do you know if you're on the verge of a potential health issue?
Well, about half the people that have a blood clot don't even know they have it. But the other half will have pain in their extremity, usually in the calf. They may have swelling in the leg. Redness and increased warmth to the leg will indicate that there's something going on, and that should cause a person to seek a medical evaluation. And typically what's done is a non-painful ultrasound, and that ultrasound test will allow us to see the veins and determine if they're patent, if they're open, and if there's any blood clots present. If there is, then that's something that we would want to obviously treat, and typically that's where blood thinners come into effect.
I actually had that done a couple of months ago. Yeah, got on the treadmill, had to do all that, got the heart rate going, but everything was fine, so I'm still here. Now, serious question I got to ask you. All right, so you're driving down the road, you're stuck in traffic. What are you supposed to do? Put your foot out the window, you know, get it up, do a little calisthenics inside? What are you supposed to do?
Well, the thing is that there are simpler things to do. I mean, the one area that we always think about with blood clots is traveling on an airplane, and certainly you're not going to put your leg out the window on an airplane. So in that particular situation, there are things that you can do, and simple maneuvers are, one is to plant your heel on the ground and to raise your foot and start doing like as if you're pushing on the gas. So that's a simple maneuver, and what these maneuvers are to cause the calf muscles to squeeze, and when the calf muscles are squeezing, that's squeezing the veins and forcing the blood. It's what's causing the problem is stagnant blood. So any stagnant blood in the extremity could then result in a blood clot. And one of the areas where we're at increased risk is people that have varicose veins, and that's also an increased risk because of stagnant blood sitting in the extremity. Another exercise that you can easily do is to plant your toes and then raise your heels. If you do that, you'll feel your calf muscles squeeze, and that's a maneuver that you can do. And then the last one, if you're sitting on a plane, is to bring your knees up towards your chest and hold your leg up and then put your leg down. So even though you're in a confined space, which is really what the problem is, a confined space, you're not moving, you're sitting there, you're in a relatively immobile situation for hours and hours. And that's where, if you're doing this for more than 4 hours, that's going to raise your problem, you know, your concern for having a blood clot.
So before we have to run, you do have compression socks here. Who do you advise wears compression socks?
Those people that are at increased risk. So if you're older than 60, obesity is a risk factor. If you've had recent surgery or if you've been recently hospitalized for more than a few days, if you're on estrogen therapy, birth control pills, or hormone replacement therapy, if you're pregnant, or if you're in the postpartum period, these are individuals that can have increased risk. Certainly if you have active cancer, if you've had a previous blood clot, all these people are at increased risk and should wear compression stockings. And they come in multiple different styles. Nowadays it's become actually fashionable to wear compression stockings, and even people that are runners are now wearing calf sleeves, compression stockings.
Took the question right out of my mouth.
Exactly.
Yep.
So these are all positives, and this is just an example of a knee-high compression stocking. For a man, this is a woman. You can wear a knee-high, or you can wear a thigh-high.
Okay. All of that works, and you can get these at a drugstore. Simple as that. Thank you so much, Dr. Dietzek. We appreciate it. Now, so